of Marion Akerman, who's not with us today. She's taking a well-deserved break, but we appreciate everyone taking the time to come and listen to our chat today, which will be providing guidance for businesses to reopen safely. We have 4 speakers, all experts in their field, many years experience, and they'll be addressing the challenges from 4 different perspectives: from health and safety, HR and staffing, protocol documentation and compliance, and observations from an international perspective. So those 4 speakers are Mary Cullen, who's the proprietor of Insight HR, Lisa Carroll, the proprietor of Worksafe Solutions, Paul Turner, head of the NSAI Legal Metrology, and Mags Clancy, commercial director at Transfermate Global Payments. So without further ado, John, I'll leave it up to you to get the ball rolling, and I hope everyone enjoys our chat this lunchtime. Thank you.
Thank you, Colin. Yeah, and away we go. I'll just say a little bit of an introduction for each of the businesses behind our 4 speakers. Lisa is the owner of Worksafe Solutions, and this is a health and safety consultancy. And today we will hear from her about how the health and safety of employees, your suppliers and your customers will be crucial to the rebooting of the economy. So that's the angle that we'll have with Lisa. And then Mary is the owner of Insight HR, which was founded 20 years ago, and today provides high quality, individually tailored HR solutions, as well as training and strategies to clients throughout Ireland. So that'll be the focus with Mary. And welcome as well then to Paul Turner, NSAI Head of Legal Metrology. The National Standards Authority of Ireland is our official standards body operating under legislation, and is accountable to the Minister for Business and Enterprise and Innovation. So as Ireland's official standards body, the NSAI aims to inspire consumer confidence and create the infrastructure for products and services to be recognised and relied on all over the world. And Paul will be giving us a steer on some of the intricacies and what we need to watch out for in the protocol that was introduced by the government ahead of basically telling us how we can return to work. And finally, last but not least, Mags Clancy is Commercial Director of Transfermate Global Payments, which is a tax-back company headquartered in Kilkenny. You're very welcome, Mags. This is truly a global company, and Mags will give us an international perspective on our topic today. So hopefully there's something in there for everybody. And I'm going to start now with Lisa, if I could ask you, what are, from a health and safety perspective, the first steps an employer should take in preparing to reopen their business?
Thanks, John. The very first thing employers need to do is have a look at the government protocol that came out there on the 9th of May. So it's very important that they read and fully understand that document, because that is the main guidance for all workplaces, regardless of size or type, in getting their own workplace back into operation, bringing their employees back, liaising with their customers, and getting everybody back on site. I suppose there's 2 steps to it. There's those who've been away from the workplace altogether and are only coming back in a phased basis over the next few months and weeks. And that document is very important to those. And then there's those workplaces who've already been functioning to a certain extent over the past couple of months since this ever began. And they've already got a lot of policy and procedure in place surrounding COVID-19 and how they're doing their business. The NSAI had a very good document out in helping them set guidelines throughout those, I suppose, the very difficult isolation stages. But at the moment, workers need to log on to the gov.ie website, into the publication section, and print off or read thoroughly that return to work safely protocol. That is going to tell them exactly what they need to do. Now, supporting that protocol, the Health and Safety Authority brought out a number of different forms to help workplaces, but they also, very importantly, brought out a template that companies can use. Now, for small companies, this is going to be absolutely ideal. For larger companies, they may already have a working committee or steering group in place, and they're well working through this document. For smaller companies, if they log on to the Health and Safety Authority website and go into, when you log on, there's got the COVID-19 section on it immediately. Log into there and it brings you into the templates and the forms for COVID-19. That workplace template is going to set you up straight away. So if you go through that HSA template in line with the government protocol, you'll be able to put together a very good return to work plan for yourselves. So it's all about having that COVID-19 return to work plan, or return response plan or work protocol, whatever you want to call it yourselves, but making sure you've the key identifiers in that plan so you can sit down with your employees and make sure everybody fully understands what it's going to take to get them back to work safely, as well as dealing with their customers and their clients safely.
Very good, very comprehensive outline there, Lisa. And indeed, you made reference to the protocol on that, which Paul will be talking to us later about as well. And there is an issue as well. It's not just in the workplace itself, but obviously getting to and from work and how we do that is important. And it raises the question, what can an employer do about this? And indeed, what are the employer's responsibilities in this respect?
Okay. The return to work plan or the COVID-19 response plan that the employer will develop should contain that information for employees. And you've got to break that down and have a look at a number of different areas. If you're providing company vehicles for employees, then it's very important, I think it actually mentions it in the government protocol, that there should only be one employee in a company vehicle, in a company car at any one time. But if you've got a situation where you've got company vans and you might be sending out a work team, so for example, if you're a contract cleaning organization, you might have 2 or 3 cleaners going to a work location on any given day. So they actually give guidance on the website and also on the construction website, the CIF website, that shows you different pictures of vehicles and where you place employees in those vehicles. So if you've only got the front driver seat and passenger seat, you have the driver in his or her own seat, and in the back opposite side behind what would normally be your passenger seat in the front, you have your second occupant of the car, and that's it. And both occupants should now be wearing a mask based on recent guidance that's come out this week. Other than that, then, if you've got a cab vehicle, so a commercial vehicle where you've got 3 seats in the front, the guidance there is nobody should be sitting in that middle seat. You've got the driver and you've got the far passenger as well. So the middle seat is kept free. And again, both people in the van should be wearing their mask. For those using public transport, I suppose this week has given us a lot of confirmation as to what is happening with masks on public transport. And what they're saying is, or they're recommending that you should wear a mask on public transport. They're not telling us that we have to. So again, it's a face covering, we should say, rather than a mask, a face covering on public transport. So again, you need to advise your employees within your own document that if they're getting public transport to and from work, that ideally they should be wearing a face covering. But it's very important then that when they get to the workplace, that they follow through your very strict hand hygiene. So immediately on entry to the workplace or at the front door, it should be the hand hygiene protocol is the very first step they're doing as they walk into that building. So those steps should be sitting down. So the worker or the employer does very much have a responsibility for their own company vehicles where they have them, but for also informing employees that might be getting public transport, the hygiene measures that they need to have in place for that themselves.
Very good. A lot to take in there, Lisa. Thanks very much for that. And obviously our employees, a business, they often say, is only as good as its workforce and the people in it. Mary, over to you. If I could ask you, this is very much your space, the whole HR challenges piece. What kind of HR challenges or issues should an employer expect to encounter when people come back to work?
Thanks, John. I think probably one of the big things that we all need to be conscious of as an employer is fear. You know, for the first time into our workplaces, there's fear. People are going to be frightened, fear of infection. You can have social isolation for those that you're not bringing back into work, because I think it's very clear from what Lisa is saying there that we're not going to be able to fill our offices, fill our shops, operate in the same way that we have done in the past. So some of our employees may continue to work from home and there may be social isolation. Many people will have experienced challenging domestic situations. It may be marital issues, maybe relationship problems, maybe challenges because they've got their children at home with them, and care of the elderly, care of the vulnerable, because a lot of those services are still not operating in the same way. So we can expect that maybe people are returning to work in a more stressed state than they have been in the past. Like Lisa says, people may be using public transport or sharing lifts to get to work. So, you know, for those people, they may not wish to travel with someone. they may be quite stressed by the time they actually get to work. And in that situation, you can find more conflict entering the workplace because people are arriving in a more stressed out state in the first place.
Very good. And what kind of supports then should employers be considering for their workforce?
Yeah, so aside from the health and safety challenges, I guess what we would be recommending right at the outset is that managers really need to lead at this point in time. It would be very important to have a one-to-one discussion with all members of your staff who are coming on board. Sit down with them, understand where they're at, how they're feeling, impress upon them the importance of complying with the health and safety standards and the regulations. There is going to be a period of adjustment because people are coming back into a changed workplace with, hygiene measures, changes in how we do things, distance from our colleagues.
Very good. I have a question in under the chat function, which I might put to you, Mary. If you have a staff member who was put on the COVID-19 system and you're taking them back on, say, the 1st of June, can you put them on a new contract, or does their old contract stay in force? And can it be a 6-month contract?
No. If somebody was employed with you and you have laid them off during the period of the pandemic or of the period, laid them off for a period of time, their existing terms and conditions still apply. So you can't actually vary those terms and conditions and offer them a different kind of contract without sitting down and discussing it and negotiating it with them. Most people will be unwilling to swap the contract of indefinite duration for a short-term, fixed-term contract. So from an employer point of view, you always have the option of laying off an employee, reducing hours of work, ultimately making somebody redundant. But what you're not entitled to do is vary their terms and conditions of employment without agreement.
Very good. Thanks for that, Mary. And a final question before I move on. What should an employer do if an employee refuses to come back to work?
Yeah, this is going to be an interesting area, and already we're dealing with a number of our clients who are having challenges getting people back to work. So I think you've got, a well-known situation where the payment that people are receiving may be in excess of the money that they're going to get when they return to work. And I think there is an issue around that. You have employer groups like IBEC calling on the government to address that immediately. If someone refuses to come back to work, again, we would be urging people to speak to them, get on the phone, talk to them on video, try and establish what the issue is. Is it childcare? Is it fear? Is it care of an elderly person? Is it fear of bringing back infection to your home? Is it fear of getting infection? You also, I guess, have to think about from an employee point of view, are they confident that their employer is fully compliant with regulations around health and safety? And that may introduce a level of tension into the workplace. So from an employer point of view, it's really important that they're communicating clearly with people and talking to them. If someone ultimately refuses to come back to work, they're absent without authorization. And then you've got to look towards your disciplinary policy to, I suppose, address the situation with them. But employers need to be careful. It's a tricky area, and they need to think through very carefully what steps they're taking and why.
Very good. Thanks very much for that, Mary. Some very valuable insights there in the HR perspective. And Paul, if I could move on to you and ask you, what information documents must a business owner look at to help them prepare to reopen their business? And I'm going to try and share a screen. You sent on a few slides to us there in advance. So if I can get those up, you can tell me when to move forward or backwards or whatever.
Thanks, John. Yeah, Lisa touched on the documents earlier on. So the most important document is the Return to Work Safety Protocol. So everything is based on that document. So it's very important that people have a good read of that document and understand the requirements that are listed in that document. And as a support, as Lisa said, that the HSA have recently, they've released some checklists. So those checklists support that protocol. And people see the link there on the debi.gov.ie website. That's where they can go to access that document. And if they go to the HSA website, they can get the additional protocols and checklists. In terms of what NSAI have done over the last number of weeks, we've developed some workplace guidance documents, two in particular. One is the Workplace Protection and Improvement Guide. This is really for the manufacturing and the services sector. And our second one is for the Retail Protection and Improvement. Now, these guides were written back in March when the COVID outbreak just happened. So these guides were really written in the first instance to support businesses to continue in operation, and we've since made revisions to them, so they're also now useful for companies who are about to open up, because we have to remember that this return to work safety protocol, it not only applies to companies who are about to reopen after closure, it also applies to companies who have maintained their businesses throughout the COVID outbreak. So it's very important that all businesses comply with this return to work safety protocol. And those two NSAI guides give people some very practical examples of the steps they need to take to keep their businesses open, and also to meet the requirements of the return to work safety protocol. The guides themselves have been divided into three sections. So the first section is defense, so how your company can defend against stopping COVID-19 coming onto your premises, either infecting your staff or your customers. The second section is what to do in the event that you have been exposed to COVID-19. So one of your staff members has reported sick, or one of your customers who is recently on your premises has reported sick, or a third party who's been working for you. And then the final section is how do you recover from an exposure? What do you need to do to get your business back up and running? So I'd encourage people to take a look at those documents. I think they're very good support documents, and it's a good place to start if you're trying to get everything in place to get your business back up and running.
Very good. I'm after losing your slides there now. Then I could try and get it back up for you there. Do you want the slide number 2 now, Paul, is it?
Yeah, I think so the first slide there is just about the documents. So again, I'd encourage people to go and read those documents. It's very, very important that you understand what's in them. Like today, I think all the speakers are going to give people a flavor of what they need to do, but it's really down to the individual companies to go through the detail and make sure they've ticked all those necessary boxes.
Very good. Well, we can make these slides available to everybody anyway who has been here today, and send them on to whoever wants them. In terms of steps that a business must take now to ensure that it's ready to reopen, or if it's already open, what must they do now to meet the requirements of the protocol?
There's a number of steps. Lisa and I touched on there a few moments ago. First things first, the company should really have a COVID response plan. So this is a document. We can call it a response plan, or you can call it a business continuity plan. So if you wouldn't mind, John, just going to the next slide. The next slide just gives a number of headings. Or maybe the slides before that. Keep going back. Keep going back. There we go there. No, go forward again.
Forward again.
That's it. Yep. So that slide there just gives people, it gives a number of headings. It's not an exhaustive list, but it just gives people a starting point. So if you are developing a response plan for COVID-19 or a business continuity plan, they will be some of the headings that you would expect to see in those documents. It's a document to give people a clear understanding of what the organization is trying to achieve, and the roles and responsibilities of people, the structures you put in place, and then it's really giving people the tools and the necessary steps to meet the requirements of the return to work safety protocols in terms of hygiene, physical distancing, etc. So again, like I said, it's just some headings to give people an idea what they need to have in that document.
Very good.
The second thing that people need to do is they need to update their safety statement, and they need to update their procedures. So I'm not going to go into detail on this today, but those slides are there for information purposes for people. So the safety statement, it's a document. By law, it must be supported by risk assessment. So people really need to review their safety statement and need to carry out additional risk assessments on their workplace to ensure that they have control measures in place to address those additional COVID-19 risks. So again, that's their 2 slides that people can look through on their own time to help them update their safety statement. There's a number of other areas that people need to be aware of as well. So it's not so much just updating the documentation, it's also communicating this information effectively to their staff members, you know, and we've seen some examples where organizations can update their documents, and in the first instance they communicate it very well, but any subsequent revisions of the documents haven't been communicated so well, or they just haven't communicated anything from day one. So it's very important to have a good communications plan in place. It's a requirement to have a COVID coordinator, and that would really be the lead person from the employer side. But you also, under the return to work safety protocol, you also have to have a lead worker representative. And the idea is to encourage open communication between the leadership side of the organization and the workers to make sure that all COVID-related protocols are put in place and that they're effective. So communication is key. Signage is certainly a big issue around organizations. Again, it's signage just to remind people about the need for physical distancing, the need for hygiene, the etiquette around coughing. But it also goes much further. It gives people confidence. You know, it gives people confidence that something is being done here and they're taking this seriously. Another form, if you like, of signage, we've talked there about the visual aids. There's audio aids where if you go into supermarkets or shops, you hear them over the public address systems. They give regular announcements, again, just reminding people of the physical distancing and the hygiene side of things. So signage is key. Probably your most valuable resource is your staff, you know, and at the moment, there is no vaccine, there is no antiviral in place. So the most effective defense people have at the moment is the physical distancing and the hygiene. So it's important in an organization to maintain that 2 meter or 6.5 feet physical distancing from other people. And in settings where you can't achieve that, and your main aim is always to achieve that, but where you can't, there are additional requirements in place for people that are working within 1 meter, or within 2 meters. So if you find that you can't keep the distance, you should look at installing engineering controls, which would be plastic barriers or sneeze guards. I think a lot of people have seen them now in the supermarkets of late. And where that's not possible, then you need to supply face masks for people, okay? The other thing you need to look at in terms of your staffing is, okay, you need to maintain your physical distancing, but you need to determine, first of all, who needs to be in the workplace, because the advice from the government is very clear. Whoever can work from home needs to stay at home. So if those people at home, you need to supply the necessary supports. You also need to look at and identify the vulnerable people. The vulnerable people are the at-risk group. So again, if you go onto the HSE website, you can see an explanation as to who falls into various categories for at-risk people. In terms of how can you protect people? So it's really about maintaining the distancing. So it's steps. And again, if you go into our guides, you can see more information about how to do this. It could be a case of just staggering the arrival times of people to work, and having staff people working in particular zones. So the people who work in the office should not be mixing with the people from the manufacturing. The people from the manufacturing should not be mixing with the people from the procurement sectors, things like that. So in the event that somebody in one zone becomes infected with COVID-19, they don't pass it on to somebody in the second zone. So that's really a way of trying to guarantee or control your business continuity. And other things we have is trying to stagger your breaks, introduce one-way systems into your building, and split shifts. So again, splitting shifts, so those shifts never see each other. So again, if there's an outbreak, you're really making sure that there is a containment system in place. Here are just some examples in an office environment. In a retail environment, you're really looking at physical distancing in terms of people entering the shop and leaving the shop. So you'd have to have queue management, queuing outside your premises. We've advised people that while inside the shops, they have markings on the floor and they have people walking around the shops, reminding people to maintain their physical distancing. Another area that people don't think about in the shop is the deliveries. So you also have to control the people delivering the materials to your shop as well, to ensure that they don't mix with your staff, or if they do, it's in a very much a controlled manner with the hand washing and with the face mask and so on being used. So they're just a few little examples of how you can protect your staff and your customers. Another requirement of the return to work safety protocol is you must have a clear induction with your staff. So it's very important that induction takes place before your staff come back and go back to work. A return to work letter is very important. Just face your staff, giving confirmation that they don't have any symptoms and that they haven't been given instructions to cocoon or to self-isolate for any reason. We've also looked as well, you also need to look as well at what to do in the event that there is a suspected outbreak or a suspected person on your premises. So you must adopt like an isolation room, a safe route to that isolation room. And that isolation room must have clear, there's equipment that must be stored in that isolation room in the event that somebody is a suspect case. So they're just some little examples around what to do. And then the final thing, it was touched on earlier on, worker supports. Like a lot of people are very anxious at this time. They are suffering from stress, some more than others. So it's very important that you have some supports in place to support your workers in these times, either be able to direct them towards literature or information online, or have actual supports available on site in terms of medical supports and so on. So they're just some of the high level areas that people must look at. But again, I would encourage people to look at the document to get all of the finer detail as well that is required.
Great stuff, Paul. A huge amount of information in there. And actually, we have a few questions coming through the chat function as well, which if we have time, we might come back to you on those. But sure. I'll move on, if you don't mind, to our next and final speaker, Mags, if we can bring you in, and really acknowledging the fact that your company is a huge employer, both here in Kilkenny and internationally. And indeed, the COVID pandemic is also an international challenge. We'd be interested to hear the perspective from a global business like yours. So can you give us an idea of the size and expanse of your operations, your employee numbers and that, and how you're dealing with lockdown over the past few weeks, and also how you see this evolving over the coming weeks?
Okay, so John, within the Taxpayers Group around the globe, we have about 1,800 staff. And they're all over like Eastern Europe, America. Like we have an office in New York, San Francisco, like some areas that are really affected. Melbourne, not so much, you know, so it's quite interesting from a global perspective, even how the different governments are dealing with getting back into work and the legislation. So it's been a challenge to say the very least, but I'm really reassured listening to the panel here today, because even when Lisa starts to talk about the government protocol, that was one of the first things that we started to do. We actually have a steering committee which has been in place since February. So before, long before actual lockdown happened. And we were planning, I guess, because continuity of business was so important for us. We have an awful lot of clients around the globe that need to use the service for various different reasons. It was business as usual. We moved out of all our offices in a phased approach. You know, 30% of staff moved first. Whoever had laptops were gone at the very beginning. And thankfully, we only ran into a couple of problems towards the end of getting dongles for people and like internet access for people in places. We didn't think it was going to be an issue. But I have to say, honestly, it was a smooth transition. We have everybody operating from home. It was business as usual. I think for the last number of months, I mean, for us, and even personally, your use of time can be far more effective. I was explaining to the panel before we started today about a meeting that we had last week with a large company in San Francisco, and I suppose up until the meeting happened that evening, I was preparing, whereas I would have been, you know, 3 days traveling, a day jet lag, and, you know, the expense that comes all around it as well. So whilst Zoom is hard, it's difficult. We have a lot of FaceTime, and Irish people don't really like cameras. You know, and you know, really it's the same thing, but it just has taken a little bit of adjustment. But I'm reassured. I suppose we have the business continuity plan in place. We have our steering committee that's going through the government protocol and making sure we're covered from all angles. But I think the most really important thing for our employees and for my colleagues right now is communication, because, you know, Paul touched off it. A lot of people are stressed. A lot of people are living at home with parents, whatever it is. Your childminder, his husband might have, you know, whatever and you know, whatever disease or something, and your child. So where we all go is very, very important to the people who we are depending on to do that child minding. You know, everyone's situation is different. And we are trying this kind of, you know, doing the one-to-one chats and the conversations, and that's all happening at the moment. Yesterday, actually, we sent out an email, a questionnaire, to get everyone to answer honestly how they felt about returning to work and when they felt they would, which month they felt was most realistic for them. So we're trying to compile all of that. But working through the government protocol really has been key. Like, we were thinking even about one-way systems. So we have a back door, the front door, you know, we're thinking about the delivery guy, making sure that the delivery person has one door that they go to, because we have a couple of different offices and a couple of different front doors, you know. When it comes to even touching off buttons, so if you think about your printers and, you know, all of those things, like maybe you have to, you know, key in an entry code to get into a department. So we've been thinking about all of these things. Recently, I think we've purchased about 3,000 face masks, so that the staff can be reassured that we're going to, I suppose, that we're going to take care of them during this, and we're not going to put people into situations, awkward situations, they just don't feel comfortable. And to be honest, they won't work effectively if you're sitting stressed out about being somewhere you don't want to be. And that will come across on the phone to our clients and our customers. So that's kind of what we're thinking about as well, to be honest, John. But when it came to even things now, last week and the week before, we were beginning to fret about taking temperatures before people walked in the door. But we've checked with the HSE only this morning, and that's actually not a requirement. So that was good to know, because we were thinking, right, if we invest in some kind of a system with a camera system and, you know, doing temperature checks before people walked in. You know, we've talked about as well, and the plan for returning will be, we'll have the dividers between desks. Like, we have very much so, you know, we'd have groups of 6 that all work together. Like, honestly, in those zones, we'll probably actually only be able to have 2 now. So we'll have staggered people returning to work. We have a COVID rep, we have safety reps assigned for this for each of the different businesses. It's COVID reps, and we've put that out to everybody from a voluntary perspective, that they would get involved. But I think to answer you about the future and what that holds, I mean, I think a certain percentage of our staff will go back in, because a certain percentage of them actually want to be back in. They want the camaraderie, they want the support. You know, and each individual is different. I know I myself probably get more done at home, but as I said, I miss kind of going to get the coffee, having that conversation, building the relationships face to face is something that, you know, we all certainly miss. But I think even online conferences are going to become more frequent now, and you'll see it on like LinkedIn and everything. Everything is a webinar now, and to be honest, where I may not have had the time to go to something, I'll probably actually go now, because it'll only actually take me 1 hour. I won't be in traffic for 2 hours going to Dublin. You know, so it will come with its, I suppose, its benefits, but there will definitely be changes. And I think for some of our employees and my colleagues, like, some people want to have, I suppose, the option to work from home, and that's come up an awful lot in terms of like the work-life balance that we have. Like, we might have people that travel to Kilkenny from, you know, Dungarvan or something, and or other far side of Wexford, and it's an hour and a half, so they're 3 hours in the car. I mean, is it the most effective use of time? So it's bringing up all of these different things. you know, but it's come with its challenges. But I'm reassured after listening to the panel today, we are doing things in the right way, but we are responsible for an awful lot of people locally and around the globe.
Yeah, and it is a very different world indeed, and we're told as well, we're beginning to hear now that COVID could be around for a very long time. It might not go away anytime soon. So, you know, looking farther forward into the more distant future, and from your perspective as a large international company, do you see what is your vision, or what do you see happening in terms of the need for large office spaces like you and others currently have, the whole concept, as you said, about working from home and so on and so forth. What does the future look like to you or in your organization? Have you looked that far yet?
Yeah, I think like we have looked at that, John, and I think we have to be mindful. Like, look at Twitter last week. They came out and said, okay, everyone can work and have the option to work remote from now on. I think where we will have a bit of a struggle with that, I mean, it's all very fine to have people working from home, but where we're bringing in new employees, it's really hard. You know, we were talking earlier about training, and you're not getting to see those people, like bringing somebody new in and they're isolated. I know other companies have definitely had this issue. It's been tough where, you know, someone was a week in and then lockdown happened and they're at home and they're trying to figure things out themselves. It's not easy. I think that there'll be a certain percentage of our employees that will work from home in the distant future. I really, really do. And I think the whole appearance of our office will look different. You know, we already have, I think the beginning of last week, they started to put in the desk dividers between each. It's not going to be that sociable environment that it was. I mean, the canteens are not going to be open for the guys, you know, so you're not going to be going in for your coffee anyway. And, you know, like those simple things that help with, you know, I suppose the social aspect of work, that's a challenge. And it's because of, I suppose, it's because of our culture as well. And we like the support of one another, and you like to be able to do that. But even if you think about your meeting rooms and your boardrooms and where you go for a one-to-one with somebody, or that just can't happen. You need to have large spaces. So all of that has to be considered, that maybe one-to-ones are actually done by video. And it would be actually more personable than sitting 2 meters away from somebody at a table. That's not exactly personable either, you know. And even look at the no shaking hands and different things like that. That's gone now.
It's a changing world, really, isn't it?
Yeah.
And it's very, very hard to see where it's going to end up. But I guess we just have to be resilient and adapt ourselves and our practices to things as they evolve, because we really don't know what's ahead.
Yeah.
But guys, I really want to thank you all very much for that. We have a good number of questions actually on the online chat. And unfortunately, we're going to run out of time, so we don't have time to field all of those. But what we'll do is collate them and contact our speakers and try and get responses back to the individuals who sent those in to us. So we'll work on that. So it now leaves for me to hand back to our Vice President, Colin Ahern. I'm watching the clock, so without any further ado, Colin, I'll hand back to you to close.
Yeah, look, John, all is left for me to say is thank you to Lisa and Mary and Paul and Mags. It was really informative. I was taking notes down here like mad, so I need to go in and do a bit of work. But no, we're very appreciative of your time. I hope everyone, I'm looking now 48 participants, I hope everyone enjoyed it. And we'll see you next week for our chamber chat next week.
Yeah, next week we're focusing on a topic, what the banking sector is doing, and we have a few experts in that line. So hopefully we'll see you all then. So thank you all very much again for your attention, and hope you enjoyed the session, and we might see you again sometime in the future.
Thanks,
Take
John.
care now.
Thank you,
Bye.
Jared.
Bye.
Thank you.